Welcome to the webinar on successful strategies for improving adolescent health. This is one of a series of webinars highlighting local, state, and national efforts relating to the Office of Adolescent Health's national call to action to improve adolescent health and development called Adolescent Health Think, Act, Grow, or TAG. My name is Evelyn Kapler. As the Director of the Office of Adolescent Health, I'm very pleased to be with you to talk about TAG and to share information about a successful strategy to improve adolescent health out in the field. This webinar will highlight an innovative effort in Louisiana called Health Centers in Schools, and we're pleased to have their CEO with us, Sue Catchings, to share her experience in developing these health centers in East Baton Rouge Parish Public Schools. Before I turn it over to Sue, I'd like to tell you a bit about the Office of Adolescent Health and TAG. The Office of Adolescent Health is located in the United States Department of Health and Human Services. We were first funded in 2010, and we're pleased to have just celebrated our 5th anniversary. The Congress charged the Office of Adolescent Health with developing a national plan for improving adolescent health. Using our limited resources and the input of experts to synthesize what we know about what works and to spur action in support of adolescent health, the TAG call to action is the first response to that charge. We're glad to be able to shine a light on an outstanding example of a program that is working across both health and education fields to improve adolescent health and is a terrific example of TAG in action. TAG builds on the collective work and insights of many professionals, researchers, and family members who know what it takes to promote the health and healthy development of America's 42 million adolescents. Teens are generally fairly healthy, but there are many missed opportunities to promote adolescent health and to intervene promptly as challenging health issues emerge in adolescence and young adulthood. TAG is a comprehensive, strengths-based, positive youth development approach to adolescent health rather than a risk-based approach. TAG is designed to help young people reach their full potential as healthy, productive adults. With TAG, we hope to spur action across multiple groups of professionals and organizations, and in communities that all share a common interest in promoting adolescent health. Stakeholder engagement is a core tenet that drives all aspects of TAG and reflects our understanding that many determinants of adolescent health lie outside the healthcare system. The goals for TAG are the following: to raise awareness about the importance of adolescent health, to engage stakeholders, including youth-serving organizations and caring adults, to get adolescent health on the national agenda, and I think most importantly, to spur action at the community level. Long-term, TAG contributes to achieving the Healthy People 2020 objectives for adolescent health that were developed by the U.S. Department of Health and Human Services. And more details about TAG can be found on the Office of Adolescent Health website. Before we begin, I'd like to point out that the content and views of the next portion of the webcast do not necessarily represent the official policies of the Office of Adolescent Health. I'm now pleased to turn things over to Sue Catchings to learn what some East Baton Rouge Parish Public Schools in Louisiana have been doing to improve adolescent health through their school-based health centers. Sue has been the Chief Executive Officer of Health Centers in Schools since 1994. In her tenure, the organization has doubled the number of school-based health centers. Health Centers for Schools provides health care to approximately 45,000 children and youth. Sue?
Thank you so much. It's great to be here today. So as you've heard, we have a very unique program here in Baton Rouge that really does bring together both the community health system and the school system. And while some people think that's an odd match, I think it's a match made in heaven. So if I could have the next slide. The Regional Medical Center, Our Lady of the Lake, is the largest hospital here in Baton Rouge. They have 844 beds. They have about 7,000 team members and about 1,000 medical staff. They are the biggest hospital in this area, and they are part of a system called the Franciscan Missionaries of Our Lady. Next slide. Health centers and schools, while we are all employed by the hospital system, we work totally inside of the East Baton Rouge Parish public school system. There are approximately 90 to 97 school campuses, and on 7 of those campuses, we have a comprehensive school-based health center. For us in Louisiana, we are regulated by our own Office of Public Health, and those health centers represent the integrated primary care and mental health, including psychiatric services and mobile optometric services. We have 18 stationary nurses. That means the nurse goes to one school and stays at that school all day for the whole school year. And 72 campuses have rotating nurses and also a support staff person to the nurse that we call a school health assistant. And we serve approximately 45,000 students every year. Next slide. One of the things about East Baton Rouge Parish, the school system, is they've had a noted performance improvement over the last 6 years. 87% of those 90-plus campuses are academically acceptable, and their enrollment ranges between that 42 and 45,000 number. What makes this system unique is that 80% of the students in this school system are on the free lunch program, and actually what that crosswalks to is that these children are all on Medicaid or Louisiana's CHIP program. Very few of our students have private insurance. We do have some, however, about 10%, and there's still about 10% that do not have insurance at all. The school system began to contract with health centers and schools for the school nurse program in 2004. So that's when we expanded across the whole system and not just the school-based health centers. Next slide. So if you could click a button. Part of why this works with the hospital system is one of our primary activities is to reduce utilization of the emergency room by students that are in the schools that we serve. We have an inordinately high number of asthmatic children, many of whom take medication at school. We have an ever-growing population of diabetics, seizure-disordered children, children with sickle cell disease, children who have some kind of hypersensitivity to either food or to insect venom. So if you push the button again, this is our mission. This is what we exist for. We keep students healthy so they can stay in school and learn. One of the things that I would say to the audience is that you must realize that to put health services on a school campus, you must remember to always be talking in the worlds of both healthcare, because we're all health people, but we live in an education world. So we have to look at academics also. And push the button again. Our goal is to improve the schools and the test scores. One of the ways we do that is we know that 95% of the time we send students back to class. They don't go home unless they're absolutely ill, and then we want them at home because that's the best place for them to be. And push the button one more time, please. We are actively pursuing many different endeavors in population health. And I also believe that because we have so many students that live at or below the federal poverty level, if you really want to do population health, you're going to go to school, because it's the one place that these students, the children and the teenagers, have to be. So if you could give me the next slide. We have strategic partnerships with many different entities and in many different arenas across Baton Rouge. We couldn't do what we are doing without all of these people coming to the table and saying, how can we help? Every year, and right now we're in the middle of it, we do what's called Give Kids a Smile Day. If I took all of the chronic disease in East Baton Rouge Parish Public School System and I just isolated and looked at oral health, I would tell you that it's going to double or triple the percentage of students that have poor oral health. It is really disturbing to me to see so many children with oral health problems that are really going to impede their health overall as they age. We work with 2 optometrists who do mobile optometry. That means they get a number of consents on a school campus. Those consents allow them to do dilated eye exams, make glasses for students, and bring them back to school. Why would we want to do that? Because most of the time, prior to the invention of mobile optometry, less than a third of the students that we failed in vision screening actually got to an eye exam. I am pleased to tell you that we have access to a child and adolescent psychiatrist, and he is backing up our clinical social workers and works hand in glove with our medical director, who's a board-certified adolescent medicine specialist. The Department of Agriculture and Forestry is the single entity that, because they have a huge refrigerated warehouse here in Baton Rouge, that allows us to do the flu project. The Commissioner of Agriculture and Forestry is a great supporter of what we are doing and gives us a place to store all of the vaccine that we give, which is thousands of doses during flu season. We also work hand in glove with Vaccines for Children at the Office of Public Health because we try to make sure that all of the students, including those 11-year-olds, are up to date with their immunizations. I have the privilege of serving as a part of the Lake Physician Group, and what that means is that I get to go to the pediatric residency programs and interact with all of the general pediatricians and the subspecialists. That is really a part of the match that has been one of the best and shining examples of what we're doing. I now know the physicians that are taking care of many of the children that have chronic disease in Baton Rouge, and they know me. We are working diligently together to make sure that we are coordinating care for those physicians and all physicians. They don't have to be part of the Lake Physician Group. Their patients that are on our campuses. We work with another program that comes through the federal government called the Nurse Family Partnership, mostly on our middle and high school campuses. We work very closely with our area health education centers because they have resources that can help us as we go down the road of teaching young people about health. We have the fortune of being in a city that has a dedicated biomedical research center mainly focused on obesity, but they are branching into other areas with Pennington. That has given us the opportunity to really participate in research studies that, in my hopes and dreams, will one day change the climate of the rate of obesity that we have in this city, in this state, but also in this country. We partnered years ago with the Greater Baton Rouge Food Bank, and we do the backpack program on a number of elementary school campuses. One of the things that I would hope that our country would realize is that many of our children go to bed hungry. They live in food insecure homes. With the backpack program, the schools help coordinate this, but the backpacks go out on Friday full of food that doesn't require refrigeration, comes back empty on Monday, and we do the process throughout the school year so that kids and their families have some opportunity to have some food. We work very closely with the Children's Coalition of Baton Rouge, which brings together all of the child-serving agencies in this city. And it's a place where we can work together and partner with each other to take better care of children. And then, of course, we have a Children's Health Project, which comes out of New York. Those are mobile buses, both a medical and a mental health bus, that have the capability of moving from school to school and see students on campuses where we don't have full-time nurses and do not have a school-based health center. Next slide. So if you'll click. The way that we've created more community impact is we are linking everything together. We are literally connecting the dots. One of the things that we have put in place that I am most excited about is our school asthma management program, and then the hospital runs an asthma camp during the summer. These two programs work hand in glove with each other, with a asthma specialist coming out of respiratory therapy from the hospital who works across the lines and into the school system so that we can take care of the children that are the most fragile and experience problems with asthma. We still have problems and challenges with this particular disease. We haven't conquered it all, but we are well on the way of beginning to connect all the dots and create a seamless program that works with the population of asthmatics in pediatrics. If you'll press the next bullet again. As I mentioned before, we do the influenza immunization program. We couldn't do it without the Department of Agriculture and Forestry, because that is literally where all the vaccine is stored. But we also couldn't do it without the Lakes Foundation. They purchase all of the non-VFC vaccine that we use, because when the superintendent of the school system said, I will do the program, I want to do the program, but you have to immunize everybody. So that meant we had to not just look at the VFC population, but we also had to look at the non-VFC population. And every year, come October, November, health centers and schools and all of our community partners come together and we immunize thousands of children in East Baton Rouge Parish. Next bullet point. We also have the capability with our buses, our mobile buses, of doing an 11-year-old immunization project. What I have found here in Baton Rouge is that many of the parents do not still understand that there are now required 11-year-old immunizations. So we're at the forefront of helping to educate the community about the importance of these immunizations and to make sure that the children actually get them many times on the school campus. Next bullet point. We do about 25,000 vision and hearing screenings annually. This is a very important part for education. If you can't see, you're going to have a hard time learning how to read. And if you can't hear, you're not going to hear the sounds of the letters, and therefore you're not going to speak appropriately. In fact, today we are planning for a one-site vision clinic that will be next week, where One Sight Foundation is on the ground here in Baton Rouge, and together with the school system, the Children's Hospital, health centers and schools, we are going to do 600 dilated eye exams and make glasses for students that need them in 1 week. Wish us luck, because we're going to need it. Next bullet point. And then I can't speak enough about oral health. This is one of, again, the most disturbing pieces that I see. We do give kids a smile day because it's the right thing to do. It's a partnership between the school system and local dentists. We need to do more. This is a huge problem in this city. But through Give Kids a Smile Day, what's so great about it is that I can contact these dentists when we run into a child that has a real challenge and we don't have a venue to take care of it because we don't have any dental operatories. And they see the children and take care of the problem because they know that there is a huge challenge here in Baton Rouge. Next slide. Oh, obesity management and education. Sorry, didn't realize there was one more bullet point. The Our Lady of the Lake system has adopted what's called 5210 plus 10. That is a 5210. 5210 is a signature national program. And it's all about educating the population, the students and their families, about eating more fruits and vegetables, spending less time on all the different kinds of screens that we have, making sure that there's at least an hour of physical activity every day, and having zero sugary drinks. We added plus 10 because that's the American Academy of Pediatrics request or requirement for sleep for adolescents. I think that if I could say anything at all, that is where we all as a nation need to look at how schools are structured, and we need to work toward making sure that adolescents come to school later in the day as opposed to earlier in the morning. Next slide. Research here has shown us that because of what we are doing, we have improved attendance and graduation rates, and we are helping the students to go out and either go to a 2-year college or a 4-year university or go into a technical trade. If you'll go to the next slide. So if you would click the button. In 2012, what we know is that if a student comes to school and has to leave, essentially what's happening is those students lose up to 6 hours of academic time. That is the time they're in the classroom learning. Well, when we look at what we do in our health centers, 22,000 visits means that they would have lost over 200,000 hours of academic time. Very unique way to look at this. But what we know is that we are helping them achieve academically. Next bullet. 2013, click again. We had about almost 17,000 visits. Oh, by the way, let me also make sure you understand that's the year we went into the electronic health record. So it does slow you down a little bit, but we get that speed back. So we had about almost 17,000 visits that year, and we would have lost 100,000 hours of academic time. Next slide. So examples of our success, I can't tell you enough about the asthma program and the camp. The camp in the summer is a week-long camp run specifically by all the partners, but led by the respiratory therapy department out of the hospital. We bring in all the ambulances. We do programs every day, but what we're really focused on is helping the children and their parents understand this disease called asthma. This program alone has reduced emergency room utilization admits by 30% and had a 50% decrease in ICU days for students who have exacerbations of asthma. We keep working on this. We're not finished. We are hoping to be part of a collaboration that will begin now to look at housing in our city, but more to come on that later. Next slide. You'll click, just hold here. I want you to meet this child. Her first name is Elizabeth. I want you to look, Elizabeth in this photograph is in 2nd grade at an elementary school. She participated in Give Kids a Smile Day. I want you to look at her smile, because what I want you to notice is it appears she has one primary front tooth, and then it begins to look a little different with spaces around her mouth. The dentist who saw this child during Give Kids a Smile Day called me during the program that was actually running, and she said, "We have a problem." And I said, "What's that?" "What's happening to Elizabeth is her other front tooth is coming in right under her nose. And so all of her teeth are moving, trying to fill up that space." So if you'll hit the next bullet. This problem was corrected because that dentist knew the orthodontist in town who saw this child and did all the work that needed to be done to correct her problem. Next, click again. It has boosted her self-confidence greatly. She is now in middle school. And click again. And it's also reduced the potential of her being bullied because the dentist and the orthodontist that worked with me for this child basically said her face would have been malformed had they not gone in and done the work they did. You'll click one more time. Meet Elizabeth. 4 years later, 2 front teeth in place and a beautiful, beautiful smile. Next slide. In terms of academic improvement, not only are we worried about students who are staying in school, but I want to know what the impact of mental health therapy is on students. This slide shows our tracking of students who participated in mental health therapy with our licensed clinical social workers and completed that therapy. And what we know is that we are showing a very large increase in academic improvement. There's a smaller, and we still are studying why don't they all improve. And we haven't figured all that out yet. We are working on it, but we do know that we are having a huge impact because of the mental health therapy that's going on in the school-based health centers. And if I could make one plea at a national, regional, and state level, we don't have enough mental health therapists. We don't have enough mental health therapy, and we're not doing prevention. We're totally just intervening. Our social workers work predominantly in prevention with mental health therapy. That is our goal, not to let them have the total ICD-9, the DSM-5 diagnosis. Next slide. So what's next? We do have a few more plans. We will continue to grow our population health programs, and those will be only limited by our own imaginations and that of all the subspecialists. We've already done a quality improvement program with asthma controller meds and shown that 60% of the students, when we give the controller medication at school, missed less days of school, understood their asthma better, and were in better control of their asthma. Click again. We continue to do ongoing training and education programs, both for the community, for the students, and for our own team members. We try to find speakers who can come in and speak to the challenges that we face and offer us unique opportunities. We train our staff for 7 days before we ever come back into a school session. Next slide. Next bullet. We have gone down the road of the electronic medical record. It's not as easy as you think it is, but it does give you the opportunity to let providers see what other providers are doing as long as you're on that same electronic record. We found that very helpful because the physicians, because they're also on Epic, they can see what we're doing, we can see what they're doing, and we can better coordinate care because we're all in the same electronic record. Click again. We are now beginning to go down the road of telehealth. in one of our high schools where we have about 1,300 children, what we've done is deploy telehealth equipment where a stationary nurse is on that high school campus. She has the capability of dialing in to both the subspecialist, some of the physicians, and also to our school-based health center nurse practitioners. So she is working with us to help us understand how it needs to look as the pilot site. This is one of the things that I believe will help us reach more children and teens. Next bullet. And then the final thing that we're doing is to do the complete integration of the programs. That's school nursing and school-based health centers, so that we are all focused and working as a team across all of the schools here in Baton Rouge. Next slide. And that's my contact information if anybody needs to contact me, and I turn it back over to the host.
Thanks, Sue, for such a wonderful presentation. We'd like to take a few minutes now to ask some questions about the work that you've been doing. So can you tell us a little bit about your rationale for moving school nursing into prevention?
Sure. I've studied the history of school nursing, actually, and school nurses came into being in this country in the 1920s. And if you think back to that time, we didn't have a lot of medication and we didn't understand a lot about how disease was spread. But nurses were put in schools at that point to detect students who were ill and to get them away or out of the school. So that's it's always been this reactionary kind of program. The times have changed now, though, and we are now trying to reach prevention through population health. I don't think that we can continue what we're doing. We have to go down this road because we know it's going to be more cost effective. So I believe that not just here in Baton Rouge, but across the whole United States, I think school nursing programs are moving in this direction because they're one more piece of the puzzle that we call an integrated health system.
Thanks, Sue. Can you tell us a little bit about how you manage the navigation between a school system and a health system?
Carefully. I've been both a teacher in a middle school, high school, and I've also been a medical technologist working in hospitals. The advantage that I have is that I understand at a building level the lingo of each of these two systems, and I understand, for the most part, how they really work. We were offered the opportunity to basically take over the school nurse program because the superintendent at that time said something that I think is very true. He said, "I'm an educator. I know about education. I don't know anything about healthcare, and yet I find myself on all of our campuses to be dealing with very chronically ill children." I think that we all need to acknowledge that this is where chronically ill children come to school in the public sector. And so the thoughts and ideas that I have that seem to be very relevant today, we have more chronically ill children coming to school. Sometimes their care represents very challenging processes. I have seen students in disease states that I never thought I'd see here in Baton Rouge. So I think that what we need to do is work together. I am so pleased to be an employee of a large health center, and I am equally pleased to be working in a school system. I do believe these two systems really need each other and they need to work together. I also believe that this is beginning to be recognized across the United States and that we will begin to see more partnerships with healthcare and school systems coming together.
So if you were given a dream program, what would it be and why?
I've already talked a little bit about why, if I had the chance to dream, and I can dream pretty big, I can tell you that. I would like to bring integrated health and mental health program to all the schools. I don't think that we can take care of students in our society today without without having mental health really right there with us. There is such a huge lack of care, in my opinion. And the way I see it playing out for particularly adolescents is they get into trouble and oftentimes end up in jail because of something that they've done. I think that if we can ever put all of this together and work, we can do not just the primary preventive care, we can also support the health systems, the physicians, with doing chronic disease care, and I think that we'll ultimately end up having oral health care at school and vision and hearing care for students where the resources are sitting at school. It only makes sense in a large school system where you've got thousands of children. So I think the urban areas around our country are moving in this direction, and I think it's only going to get bigger as time goes by.
Right, thanks, Sue. Can you tell us a little bit about why you invested time and dollars in the Student Alliance Council?
I absolutely can. This has been one of the last pieces that we've added. Telehealth will be the next piece that we're working on. I think that this particular program of selecting a group of students, and in Baton Rouge we have 2 or 3 students from every public high school in our system. They are part of the Student Alliance Council. But what we are really doing is we're learning from them as much as they are learning from us. And I know that these two things have to be intertwined, health and education. I think it's an interesting place for us to work. I also think it's going to help the community as a whole in the long run because we're really looking at the social determinants of health. Everything, in my opinion, about a community goes to what does its school system look like and how are they supporting their children.
Thank you, Sue. Thank you for sharing with us today your experiences and your work, which is so helpful. On behalf of the Office of Adolescent Health, I want to thank you for joining us to learn about the Office of Adolescent Health and Think, Act, Grow, and to hear about the wonderful work going on in Louisiana. I especially want to thank Sue Catchings again for sharing the story of how combining healthcare services in school settings can bring about better outcomes for young people. We'd love for you to get involved and spread the word about Think, Act, Grow within your own professional networks. And there are lots of things you can do. I encourage you to explore our website, to check out the TAG playbook, to join TAG and get email updates from the Office of Adolescent Health. I encourage you to notify your colleagues and grantees about TAG. I encourage your organization to use the TAG action steps and resources. You can blog about TAG, and we have sample texts in our TAG toolkit. I encourage you to ask questions, share ideas, and stay in touch. I also encourage you to use TAG social media tools to reach some of America's 42 million adolescents and adults who care about them. We encourage you to stay connected to the Office of Adolescent Health and our TAG call to action. Here's the URL for the TAG landing page. You can email us at tagteam@hhs.gov to let us know how you're using TAG and to share your successes and ideas for collaboration. You can follow us on Twitter at TeenHealthGov and monitor the TAG 42mil hashtag to see what's going on with TAG. Thank you for joining us today.